Hello again, this is Patrick, your respiratory therapist here at the hospital. We've already done 2 videos of how to ventilate people with these machines. We already did the Puritan Bonin 840, we already did the LTV home ventilator, and now we have what you are used to seeing as our BiPAP machines, which can also do some mechanical ventilation with intubated patients. So the setup on this one's just going to be a little slightly different than the other 2 machines. You're going to have a tubing, which I'm going to pull up here, which comes in a bag. This tubing is a single tubing with a little clear tubing on the side. You will need the whole thing, unlike the Puritan Bonin. You're going to have 2 ends. The ends that are disconnected or separate compared to the other end, this is the end that goes to the machine. If you look at the machine, you got your screen, your on-off button, and over on this side you have your connection ports for the tubing. And I'm going to plug this tubing in, the large tubing, and then this tubing is for monitoring pressure. So what I'm going to do is plug it into this little port right here, and it is a little tough to put on, but you can manage to put that on. At this point, you would connect the same connection you would have your HME that we used on the other ventilators. You're going to connect your HME, your Ballard or suction, and again it unplugs here and it unplugs here. There we go. You plug that in, plug it in here, and you would connect it to the end of your circuit, just like that. If it doesn't seem to plug, for example, oh no, it doesn't want to go, in the bag, if it's not connected to the end of this tubing, you'll find this little plastic piece. Just insert it into the end of the tubing and into your HME, and you're all set. If you look, you see this little blue rubber plugs here. You got the clear tubing that's plugged into this side into a port. That must stay. And here's a plug for that if you were to unplug it, but in our circumstances we need this tubing, so we're not going to have it plugged. And if I turn it to the other side, and if we could zoom in closely, you'll see that I have another hole right here. That is an exhalation port. You want to make sure that this is not plugged by this little blue thing. You want to make sure that it's open. This is where the patient is going to exhale from. All right. Next, we'll set that down and we'll go back to our machine, to the main screen. To turn on the machine, you're going to push a button. It's going to make some noise and you're going to hear it kick on and blow some air. Once you have that on, can you see the screen okay with the light on? All right. What we're going to do is hit standby. This will stop the machine from ventilating while we're setting the settings into the machine. Notice it says running on internal battery. This machine does have a battery. So I'm going to spin it around here to show you the back. We have the oxygen tubing and we have the power cord. We're going to plug those into the wall. Go back to the front of the machine here. Notice it crossed off running internal battery. That's because the machine sensed it was plugged in. So if you are going to be using these machines, you know, if you make a little mistake like that, the machine will tell you in this little message board what's going on. To set this machine, we're going to follow these tabs here at the bottom. Notice that it says waiting for patient trigger or restart. Well, right now we're going to set the machine. So we're on standby. We're going to hit the menu tab and we're going to start with mask port. This determines whether we're using a mask or if we're using an ET tube or what kind of mask we're using with the machine. For instance, right now it's set on ET tube trach, and I know that for sure because it's in this box right here. If I were to hit this little arrow key on this side, you can see it's giving me different symbols with number. Those are for different types of mask. But for this intensive purpose of this video is to have people that are intubated to be placed on this. So we're going to say ET tube trach. We're going to come to the right side of the screen where it says accept. And we're going to hit accept. Then it goes on to the next thing we need. The DEP is the disposable exhalation port that we just saw in the tubing, which I'll bring right back up here. This little exhalation port, this little piece right here is what the image is showing on the screen right in this corner. So you can verify that you have the right one. There's other options which give you different images. So we're just going to select the DEP port and we're going to click accept. We are done in this menu. We don't need to adjust loudness, brightness. Those are already set, so we don't have to worry about those. So we'll go to our next tab, which is the settings for the actual ventilator. We're going to hit that tab, and that's the mode. While we're intubated, we will not use CPAP and we will not use the ST mode, which are what we're commonly used to for the BiPAP modes and CPAP modes. We're not going to use those. We're going to use either a batch AVAPS or PCV, or pressure control ventilation. To start with, we're going to use batch AVAPS. So we're going to select that. You can see it brings us to the next menu where all the settings are. This is the closest thing we have to volume ventilation on this machine. Again, tidal volumes will be received from the physician. We're going to set a tidal volume. For intensive purposes, we'll keep it the same what we have been setting before. 450, hit accept. Respiratory rate, again ordered from the physician. We've been using 18, we'll do that, accept. I time, we're just going to leave at 1 second. Rise time, we're just going to leave at 1 second. I time is the amount of time you spend in the inspiration phase of your breathing, and rise time is how quickly you get your flow from the machine. Next row underneath that, and notice that the ones we've changed are yellow and the other ones are white. When we activate it, they will all change and it'll change color. Next one is EPAP. That's usually a BiPAP name for end expiratory airway pressure. In this purpose, we're going to be using, replaces the word PEEP on the other ventilator machines. That's what it's referred to as, PEEP. We're going to do 5. The lowest you can go on this machine is 4. We will set it to 5 if the physician requests, and click accept. Next are max and min airway pressure. These are pressures that the machine will vary between to achieve this tidal volume. Good place to start for now will probably be anywhere from 10 to 12. We'll just use 10 for now, and the max pressure may be 30. Accept. That gives us a little bit of room. If the patient's hard to ventilate, we can increase the pressures to help compensate. But these are good initial settings to start with a patient. Pending on the physician's decision of tidal volume, respiratory rate, and FiO2 and PEEP. To change FiO2, just like the other things, you can select. And we'll keep it on 21% for now. Once you have all your settings set in this machine, you're going to want to hit activate batch change. And notice it all changed to blue. You are now ready to ventilate the patient. At this point, I'll bring this up towards the screen here. We're going to connect our patient. And when we connect our patient, and he takes a breath or she takes a breath, it activates the machine. If not, you saw the button at the top where you can hit it and activate it manually. To reset these settings here, you just hit reset alarm, and you can see the waveform appears all the way across the screen. You can see that you got your ventilation going on, and also you can, if the patient takes a breath, and you can see me squeezing the bag. I did it really fast and it made an alarm go off because the alarms are set. So if we go to the next tab, we can look at the alarms. We have a high rate. On the other machine we set it to 40, so we're going to set it to 40. If the patient's breathing 40 times a minute, we know that they're really sick or something is going on. So a high rate of 40 is a good number to go with. A low rate, if they breathe less than 8 times a minute, that would be terrible because they wouldn't be moving any air. So maybe we want to do 10 breaths a minute as our minimum. So if they're breathing less than 10 times a minute, the machine will alarm. We got our high tidal volume, which on our other machine we set to 800. So we can lower this one to 800. There we go. And we'll hit accept. And then we have our low tidal volume, which is 200, which our other machine we set to 300. If you're not taking at least 300 mils, unless you're a really, really, really small person, it won't be enough. So this is a good alarm settings. Your high pressure alarm, that is again, if like on the other ventilators, what we call the peak pressure alarm. In this machine, it calls it high pressure alarm, or HIP, which we set to 40. Low pressure alarm is, again, if we were to disconnect, we got a low pressure. We want that to be above our PEEP. We want that, if you go back to our settings here, our PEEP is set at 5, so I'm going to go back to alarms. We want this at least above the 5. That way we know if there's a problem, a disconnect. And this right here is a low pressure time delay. So for instance, if the pressure were to drop and it would go below 8, it takes 20 seconds for that to activate the alarm. So it's giving time for, let's say you just took this off for a second and repositioned it. It just allows a little bit of time before the alarm goes fully off. But that is a low pressure alarm. Right here you have low minute ventilation alarm, which is on the other machine, the 840, you set a high number and low number. On the LTV, you would set just the low number. Just like the LTV on this machine, you would set just the low alarm, which we were setting at 18 for a high and then a 3 for a low. And again, this one's already set to low. And notice if we look at the alarm, since it says low tidal volume, again, I've been moving the tube around as we're going. And now it's going to give me a higher rate because I'm making it breathe really fast. And you can look at the top of the screen, you can see the respiratory rate, you can see the tidal volume, you can see the minute ventilation, and you can see the peak inspiratory pressure. And to reset the alarms, you hit there. And that basically concludes setting up this machine. If anytime you need to silence the alarm, you can hit the 2-minute, and that gives it a 2-minute quiet time. Let's say you wanted to disconnect the patient to reposition the tubing, which sometimes occurs as we're trying to reposition the patient. You can keep it quiet. Anytime you want to suction a patient, you can hit the 100% oxygen, and it'll give 100% oxygen. If you notice, it's for 2 minutes and it has a countdown. And if you change your mind, you can always hit a cancel and it brings it back to whatever your setting is in the machine. So that basically concludes the setup of the V60 BiPAP machine that we use as a ventilator. And if you have any questions, contact your respiratory therapist or your physician for answers. Thank you.